The shocking truth about tobacco, cigarettes, and drug use. Every day, millions of people around the world use tobacco, cigarettes, and other harmful drugs, often without realizing the full extent of the damage they cause. What may seem like just a habit, a way to relax, or something to try once, can quickly turn into a dangerous addiction that destroys both health and life. These substances don't just affect the person using them, they also harm families, communities, and even innocent bystanders. Understanding the deadly truth behind them is the first step toward protecting yourself and making healthier choices. Tobacco is made from the leaves of the tobacco plant, which are dried and processed before being used. At first, it may look like just another plant product, but the real danger comes from the chemicals inside it. The main one is nicotine, a substance so addictive that it keeps millions of people hooked even when they know the risks. Along with nicotine, tobacco contains thousands of other chemicals, including tar, carbon monoxide, and many proven cancer-causing agents. When people chew tobacco, sniff it, or smoke it, these harmful substances enter the body and begin damaging vital organs almost immediately. Long-term use of tobacco is strongly linked to lung cancer, heart disease, chronic obstructive pulmonary disease, COPD, stroke, and many other deadly illnesses. In fact, tobacco harms almost every organ in the human body, making it one of the most dangerous legal products in the world. Cigarettes are the most common way tobacco is used. A cigarette is basically finely cut tobacco leaves rolled in thin paper, designed to be burned and inhaled. But when smoke enters the lungs, it carries thousands of toxic chemicals deep into the body, including arsenic, formaldehyde, and benzene, substances also found in poisons and industrial products. This is why cigarette smoking is a leading cause of cancer, respiratory diseases, and heart problems worldwide. What's even more alarming is that cigarette smoke doesn't just harm the smoker, it also affects people around them through secondhand smoke, leading to illness and death even in non-smokers. Other drugs such as heroin, cocaine, methamphetamines, and even the misuse of prescription medications also pose serious risks. These substances can alter brain chemistry, damage the heart and liver, weaken the immune system, and increase the chances of overdose. Many of them create strong dependence, trapping people in cycles of addiction that are extremely difficult to break. Beyond physical health, drugs often destroy mental well-being, family relationships, and entire communities. The numbers tell the story clearly. Tobacco use alone kills over 8 million people every single year, and about 1.3 million of these deaths are from secondhand smoke, people who never smoked but were exposed to it. That means nearly 670,000 people die every month because of tobacco. Other harmful drugs are responsible for around 600,000 deaths annually, and when alcohol is included, the total rises to more than 3 million deaths every year. The truth is undeniable. Tobacco, cigarettes, and drugs are among the leading causes of preventable death worldwide. They don't just shorten lives, but also destroy quality of life, causing suffering for millions of families across the globe. Beyond nicotine addiction and the well-known risk of cancer and heart disease, tobacco carries hidden dangers that are often overlooked. Smoking damages blood vessels and reduces circulation, which can lead to impotence and infertility in both men and women. It weakens the immune system, making the body more vulnerable to infections like pneumonia and tuberculosis. The chemicals in tobacco also speed up skin aging, causing wrinkles and premature aging long before it should appear. Pregnant women who use tobacco increase the risk of miscarriage, premature birth, and babies born with low birth weight. Even smokeless tobacco like chewing tobacco or snuff can cause cancers of the mouth, gums, and throat, along with severe tooth loss and gum disease. These hidden effects show that tobacco is not just deadly in the long run, it steals away health, vitality, and quality of life every single day. Now, other than tobacco and cigarettes, there are many other harmful drugs that pose serious risks to both physical and mental health. Marijuana, also called weed or cannabis, is one of the most commonly used recreational drugs worldwide. While some people consider it relatively harmless, frequent or heavy use can have serious effects on both the brain and body. THC, the main active ingredient in marijuana, alters brain function and can impair memory, attention, and learning abilities, especially in adolescents and young adults whose brains are still developing. Long-term use can increase the risk of anxiety, depression, and in some cases, trigger psychotic episodes in people who are vulnerable. Smoking marijuana can also harm the lungs, causing chronic bronchitis or respiratory irritation, and it may impair coordination and reaction time, increasing the risk of accidents. Regular use can lead to psychological dependence, making it difficult for users to quit even when they experience negative effects. Heroin is an extremely addictive opioid that can slow breathing, cause severe withdrawal symptoms, and often lead to fatal overdose. Cocaine and methamphetamines are powerful stimulants that can damage the heart, brain, and nervous system, raising the risk of stroke, heart attack, and long-term mental health issues. Each of these substances carries serious short-term and long-term consequences, and none are truly safe. Most people know that drugs are dangerous, but sometimes facts and statistics alone aren't enough to make us really feel it. Let me tell you a story, a real-life example that shows how quickly these habits can take hold, and how much stronger and healthier you can become when you choose to say no. Take the example of Rafi, a man in his late 20s who had big dreams for his career and family. For years, he struggled with the habit of smoking cigarettes and occasionally using marijuana, thinking it was just a way to cope with stress after long workdays. At first, it felt harmless, a temporary escape from pressure. But over time, Rafi noticed the effects creeping into his life: constant fatigue, shortness of breath, difficulty concentrating, and a growing sense of anxiety and low motivation. His health was declining, and he realized that his lifestyle was putting his future, his career goals, his family, and even his ability to enjoy everyday moments at serious risk. One evening, while playing with his young niece, he had a powerful realization. He didn't want these habits to control him or rob him of the life he was working so hard to build. Rafi decided it was time to take control. He sought support, gradually replaced unhealthy habits with regular exercise, mindfulness practices, and hobbies that gave him purpose, and committed to staying away from all harmful substances. Months later, the change was remarkable. He felt stronger, healthier, and more focused than ever. His confidence soared, his productivity improved, and he became an example to his peers, showing that it's possible to break free from addiction at any age. Rafi's journey proves that saying no to tobacco, cigarettes, and drugs isn't just about avoiding harm. It's about choosing strength, reclaiming control, and creating a brighter, more fulfilling future. Now, the lesson from this story is, true strength is not about avoiding temptation. It's about rising above it. Every time you choose to stay away from drugs, you're choosing health, freedom, and the power to shape your future. The good news is that it's never too late to take control of your health. The first step is awareness, understanding the risks, and making a firm decision to avoid tobacco, cigarettes, and other harmful drugs. If you're already using these substances, seeking support is crucial. This can include talking to healthcare professionals, joining counseling or rehabilitation programs, and surrounding yourself with people who encourage healthy habits. Simple lifestyle changes like exercising regularly, practicing mindfulness or meditation, and finding hobbies to manage stress can also help reduce cravings. Education is equally important. Learning about the long-term effects on your body and mind can strengthen your resolve. By taking these steps, anyone can break the cycle of addiction, protect their health, and inspire others to do the same. The truth is, no cigarette, no packet of tobacco, and no drug is worth your health, your future, or your life. Every time you choose to say no to these substances, you're choosing to protect your lungs, your heart, and your mind. You are choosing more years with your family, more energy to chase your dreams, and more freedom from addiction. The power is in your hands to rise above temptation, to take care of your body, and to inspire others by living a healthier, stronger life. Remember, real strength is not in giving in, but in walking away. If you found this video helpful, don't forget to like, comment, and subscribe for more content. Hit the notification bell so you never miss an important tip for a healthier life.